If you have an itchy or flaky scalp, this video is for you. We're going over everything: dry scalp, dandruff, seborrheic dermatitis, and scalp psoriasis. We'll cover the differences, which one do you have, and how to treat them. If you're new here, welcome. We are Noted Dermatology. I am your personal board-certified dermatologist, and I am here to give you an unbiased education about your skin. Visit us online at noteddermatology.com. Alright, let's start with a dry scalp, and a dry scalp is simply the lack of water. Normally our skin barrier is nice and thick and water stays in, but in a dry scalp that barrier is damaged and water escapes right out, and as a result we have a mild itch and tiny white flakes. If you have sensitive skin to begin with, you're more prone to developing this condition. And the treatment is giving your skin some time to heal so the barrier comes back to its full strength, which takes about 2 weeks. During this time, you can use a scalp treatment to further protect that barrier and also just go easy on your scalp. Use gentle ingredients only, avoid harsh chemicals and too much heat, things like that. And moving on to dandruff. Dandruff is caused by yeast that's normally on all of our scalps, but for some unknown reason, people with dandruff have an abnormal reaction to this yeast. Normally, our skin cells cycle from the very bottom to the very top of the epidermis, and this takes 28 days. And in dandruff, again, for unknown reasons, this process only takes 7 to 14 days. So we have these immature skin cells clumping up, forming these flakes that you can see. The flakes here are bigger than those of a dry scalp. Another giveaway for the flake is sometimes they're so big you have what I call hair holes. That's not a technical term, but it's a giveaway. As far as how to treat this, we have to treat the yeast. So there's plenty of over-the-counter options. There's Selsun Blue, Head and Shoulders, ketoconazole, things like that. Sometimes you have to use a combo of these and alternate with a gentle fragrance-free shampoo. And moving right along to seborrheic dermatitis, or sebderm as we call it in the biz. You may also know this as cradle cap in babies. You can see the yellow scale of this baby with the cradle cap. And again, you can see the yellow in adults as well. I think of sebderm as the poorly behaved older brother of dandruff because it's just like dandruff but with lots of inflammation. That inflammation causes itch in the scalp, and also it causes the scalp to be red because of the increased blood supply. When we compare here, you can see how much redder the scalp is of the sebderm compared to regular dandruff. In addition, another giveaway for sebderm is that the flakes are yellow. Again, let's compare to dandruff and you can see just how yellow the flakes are in comparison. When we compare to cradle cap, you can see they're very similar because there's the same condition, just in different parts of life. A classic context clue for sebderm is that it can also appear on the face, on the chest, on the back. We call this, ironically, a seborrheic distribution. As far as how to treat it, there are 2 parts. Number 1, we have to get rid of that yeast. So the same things that we use for dandruff, we use for sebderm as well. And the second part of treatment is reducing that inflammation. You can buy hydrocortisone over the counter, though if you come into the dermatology clinic, we can prescribe steroids that are much stronger. And moving on to psoriasis. Psoriasis is caused by an immune reaction. We don't really understand why it happens, but psoriasis can be very itchy. The skin is inflamed, it's thick, it's red. It's most common at the back of the scalp, but it can go onto the forehead or behind the ear. Psoriasis flakes are white and they're dry. They might be a little powdery. Another classic context clue is if you have psoriasis elsewhere. To treat scalp psoriasis, we need to do it again in 2 parts. The first part is to descale, to get those thick, dead clumps off of the skin so more medication can penetrate beneath. Step number 2 is to reduce inflammation, usually with topical steroids. So how do we do this, practically speaking? To reduce the scale on the scalp, we usually use a medicated shampoo, something with salicylic acid. These are a few options, but you can also use just plain coconut oil. That also helps to get the dead flakes off of the scalp. Once we've taken the scale off, then we can move on to the second part of treatment, which is reducing the inflammation. And how do we do this? With our best friends, the anti-dandruff shampoos. Now, if you're thinking, wait a minute, we haven't mentioned yeast in the psoriasis section. Why are we using a dandruff shampoo? Well, whenever skin is very inflamed and broken, it's just ripe for infections. Think of it as if you had a cut on your leg and you just let it go, it's probably going to get a bacterial infection, and it's not going to heal until you take care of that bacterial infection. The scalp is the same. If it's open, inflamed, yeast is going to come, it's going to grow, and it's going to make it harder for the scalp to heal. In addition, many of the ingredients used in these dandruff shampoos are also anti-inflammatory as well, so they work on a couple different levels. And there are the elite few who do both jobs of getting rid of the scale and reducing inflammation, and that's basically coal tar. Coal tar shampoos work very well. This is a product that desperately needs a Gen Z makeover because all the products look something like this, but it does work well. All right, now we are all experts on the scalp, and let's compare. Let's compare flakes first. So the dry scalp, you have these little tiny white flakes. Dandruff, they get a little bigger, but they're also whitish, maybe some yellowish with those hair holes. Sebderm, we know these are very easy because it's going to be yellow. And psoriasis has that thick, powdery scale. As far as skin redness, we know that sebderm and psoriasis are the only ones that have red skin, and this relates to the itchiness level as well. Dry scalp, a little itchy, but sebderm and psoriasis, very itchy. And finally, how long do these things last? Dry scalp comes and goes. It usually comes in the winter, so it's very temporary, whereas sebderm and psoriasis are chronic conditions that need to be managed. And that is a whirlwind overview of an itchy, flaky scalp. If you have any questions, put them in the comments below, and please subscribe. Thanks so much.